Hi, this is Dr. Ashok B C, plastic, reconstructive and aesthetic surgeon at Aster Whitefield Hospital, Bengaluru. Today I am going to introduce you to the Aster International Institute of Lymphology. We at this place cater to large number of lymphedema patients, be it a congenital one or an acquired one due to diseases or due to surgery. What makes this place very special is that we have the best of the equipment in terms of investigations, be it an ICG machine or lymphoscintigraphy. We also do stratification of the disease and the type of the disease so that we know exactly where to place you and cater to your needs. Specifically looking at the stage of the disease, we can suggest you different kinds of treatments, starting from very simple and house remedies like massaging and compression garments, which you can continue at home, or in even very advanced surgeries like lymphovenous anastomosis or lymph node transfers, what we call. And in very advanced stages, we can also do something called an excisional surgeries, where we can reduce the volume of your limb so that you can become more mobile. And all this is done in a quaternary care settings where our anesthetist, our post-op care, our ICU will take a good care in the post-op period so that the post-op period is very, very uneventful and you can go home very quickly. Now, coming to the doctors here, both the doctors who work here in the Department of Plastic and Reconstructive Surgery are highly trained and very experienced. And in fact, I have been trained in Japan to do these lymphedema surgeries, and I have been practicing lymphedema surgery for the last 8 to 9 years. And we have catered to large number of patients with lymphedema with very good results. So, if you have lymphedema and if you come to our clinic, the lymphedema clinic at Aster Whitefield Hospital, Bengaluru, we are going to first measure the volume of your limb to measure what is the difference between your right and left or to the normal. Then we are going to do an ICG scan. This scan is an advanced scan which stratifies the disease to tell us which grade you are in. The reason why we need to do this, each grade of lymphedema needs a different kind of treatment. So the ICG scan is done by giving a small amount of injection on the dorsum of your hand, and we use an infrared camera to scan. And in a real time, we get to see how the lymphatics in your bodies are working, how good they are, where is the block, and what grade of lymphedema you have developed. Based on this, we can suggest you a treatment which will be the most effective treatment for that stage. And this helps us just to make sure that you have lymphedema first, and if there is lymphedema, what stage you are in, so that we can specifically curate a treatment for you. And in the post-op periods, when you come for follow-up, we regularly maintain this volumetry or the limb volume measurements, so we know exactly where you are going, what is your path of recovery, how good you are recovering. And there is a very good physiotherapy department who are in the department who will take care of your massaging techniques and compression garments. Thank you so much.